Hi, I'm Greg Stanley. I'd like to talk for a few minutes about a concept, a principle that might help explain some of the difficulties you've had in the past, especially in the area of marketing and practice building. We call it the CCR, or Competitive Challenge Ratio. That is the number of prospective patients in your immediate drawing area to the number of prospective or competitive doctors, the people that you're up against, so to speak. A normal competitive ratio is about one doctor to between 11 and 1,200 prospective patients. This is healthy, it's normal. That means that the average level of consumerism, that is the normal person's pricing, the quality of their staff, their hours, their location, will probably get them to the goal that they want to reach. On the other hand, if you're in Southern California or certain areas of various cities in this country where there's somewhere between 400 and 600 prospective patients per doctor, it becomes much more difficult. In fact, one time a doctor called me. He had a video commercial that he was airing in his area that was bringing him over 110 new patients a month. He wanted me to distribute this commercial that he had produced to other doctors around the country. The more we got to talking to them, we realized that he was in an area, a rural area, where there were only 3 local television stations. And the ad he did was very crude, but there was no doctor. In fact, he was the only dentist in over a 100-mile radius. His conclusion was that he was an advertising genius. We have seen this many times. The same things that work in one area don't work in another area because of the competitive challenge ratio, or the CCR. For example, in an area where there's a density of competition, your pricing has to be fiercely competitive, especially with what we call the comparables. How a staff person handles that incoming call. She does not or cannot afford the luxury of screening these calls to make sure that everyone is told before they come in that they will need to bring a check, some bullion, 2 forms of ID, and verification of their insurance. On the other hand, just the opposite. She's got to be more outgoing. She's got to reach out to these people and get them into the office and solve the problems that they bring to the practice. So competitive challenge ratio tells you that we are graded on the curve in dentistry. Some offices that are thought of as superstars in this country, if they were moved to far more competitive areas, would probably quickly fail financially.